beautiful little kid, wonderful guy.
Hold him up.
Everybody here? Can you hear everybody?
I'm gonna stand up.
I'll stick it back over. Okay. I'm gonna pass them around. Yeah, we're gonna pass them around. My son Matthew was an addict. Addiction is defined as a chronic relapsing behavior in the face of negative consequences, the overwhelming urge to continue something you know is bad for you. Addiction is an intractable disease. The use of drugs has been recorded since the beginning of time. Life with an addiction is like walking around with a ball and chain shackled to your leg everywhere, keeping you from reaching your full potential and controlling your life. The causes of addiction, much like the individuals it affects, are always unique. Addiction is a treatable medical illness. The brain is literally changed and helps to explain why you can see the compulsive and destructive behaviors exhibited. The co-occurrence of substance abuse disorder and mental health disorders are common because similar areas of the brain is affected. Statistics show that 40% of those with addiction also have mental health issues. My son was bipolar, and he also had an acute anxiety disorder. He turned to drugs to take the pain away. My son Matthew was born in December 1985. He has two older sisters, Christy and Katie, and 23 months later, he had a younger sister named Maggie. Matt was the first boy on both sides for 32 years. He had a normal early childhood. When he was 11 and a half, he started experiencing periods of dread upon awakening and several times through the day. He began seeing a psychiatrist, and in his preteen years, he was started on Adderall for ADD. He loved sports, but his passion was hockey. He was an amazing skater and became more proficient each year. Hockey was his life. He began self-medicating at age 14 and drinking with his friends. About 15, he started taking ecstasy and unfortunately was given some laced with rat poison. It landed him a lengthy stay in behavioral health where he was incoherent for weeks, but then magically returned to baseline. Early addictions were a hodgepodge of pills, weed, mollies, and cocaine. At age 25, Matt became snorting heroin. This was the beginning of his downfall. In November 2013, he was found in his apartment unconscious and taken to Barnes, where he lay paralyzed from the waist down. He had so many drugs in his system, they didn't know how he survived. A thoracic stroke was discovered, as they found many clots in his spinal cord. These are normally only found in autopsies. Barnes had only seen one other case where the patient had survived. There are many articles published in medical journals about my son's resilience. His paralysis lasted for months. He had 2 lengthy stays in rehab hospitals and then rehospitalized at Barnes for near-death sepsis. After 4 months, his body recovered, and after endless hours of physical therapy, he returned to 100%. You would think that having to catheterize yourself to urinate and also use a wheelchair to move around would have been rock bottom, but no, it was not. Matthew was actually doing drugs as an inpatient at Barnes. At different times in Matt's late 20s, he was placed on Suboxone and did amazingly. He still believed it was a form of drug use, though, and wanted to be totally sober. Watching him withdraw from Suboxone, even done gradually, was grueling to watch. The drug Suboxone works by tightly bonding to the same receptors in the brain so that opiates such as heroin, morphine, and oxycodone are blocked. By doing so, it blunts intoxication with these drugs. It also prevents cravings and allows people to live a life of relative normalcy and safety. After 1 year of sobriety, Matt used heroin again, and I found him in his room, cold and blue and pulseless. I was able to start CPR and get him to the hospital per ambulance. He was then found to have 5 cerebral strokes or in his brain and another thoracic stroke. This stroke paralyzed his left leg, and with much intensive therapy and extensive leg brace, he was able to walk. Matthew sustained also a 30% hearing loss from the cerebral strokes at this time. Matt had been in numerous programs, both in and outpatient for physical and behavioral health rehab. He had many psychiatrists, always searching for the right cocktail for his mental health issues. He would do well on some meds, but then the psychiatrist would change his meds, or Matt would feel so good, he would take himself off the meds. Matt told me once that after he used heroin, I would never want to be in his brain. Not even for 1 second. The drug never stopped begging him for one more time. Also, the high he experienced from heroin was shorter in duration. The reckless side of addiction affects the entire family. The lying and manipulative behaviors are hard to manage. Trust is gone. The incredible cost of rehab, psychiatrists, hospital stays, medical care, behavioral health, counselors, therapists, support groups, and cobraing his every job, maintaining his insurance, were staggering. Matt was unusual and always had a great job since the age of 15. He was very respected and welcomed back to every job even after lengthy hospitalizations. Another testament to his determination and strength. Matt was the kindest man I have ever known. He had experienced such pain. He had deep appreciation for everyone. He loved animals and often had 2 dogs at a time, and we are fortunate to still have one of his tiny miniature dachshunds, a small piece of Matt on earth. Matthew was lucky and never had an arrest or jail time in his 18-year bout with addiction. The last 7 years of Matt's life were the most intense, despite his lengthy bouts of sobriety. We tried everything. We hopped from doctor to doctor only to find Suboxone factories and mindless pill pushers. We were trying to find Matt some relief from this madness. Our whole family was in this together, but my husband and I stupidly believed in his early years that this is something Matt would grow out of. Looking back, I wish we had been more proactive. We just would wait for things to happen and deal with the fallout. The panic we lived in daily was inexplicable. Our lives were swept by fear and hope, shame and despair. How had we failed as parents? But nothing was as devastating as his death. The best parts of Matt's life were his family, and of course I'm slightly biased. He also loved his nieces and nephews, firstborn Isabel and Grace, who are now 11 and a half years old twins. They still talk about their uncle regularly, as they were so enamored by them and loved spending time playing games with him. He gave the best presents, that's a quote from them, and he was so proud. Then his nephew Sam was born, who is now 8 and a half years old, and they were the best of buddies. He was able to spend lots of time with Sam because his first stroke happened 6 weeks after Sam was born. Sam continues to keep Matt's memory alive, as do the twins. His youngest niece, Lucy, who's now 5 and a half, was born, and Matt devoted his sobriety to her. He said he never wanted Lucy to see him as the loser uncle. But sadly, when Matt relapsed after 3 years and 8 days, he was met with pure poison, fentanyl. Prior to his relapse, he had a terrible week. Car accident, many people who disappointed him. He had visited 2 psychiatrists' offices and begged for help from his staggering anxiety and was turned away. He went to the ER and was also turned away because they told him he didn't want to hurt himself. He also had all his teeth replaced at this time due to gum disease. And during that time, he had all his teeth removed and replaced. He never had anything for pain due to his status for being an addict. He was severely depressed, and because some of his early behaviors in life had caused friends to stay away, not included in their weddings or other celebrations. They could drink and dabble in drugs, but they were not addicts. In the end, the breakup with his girlfriend, extreme loneliness, severe anxiety caused him to relapse. He relapsed responsibly, snorting 1 capsule, which he believed to be heroin. There was 2 kinds of fentanyl, and its filler was Tylenol. 1 capsule contained enough fentanyl to kill 60 to 80 people. It was lethal. Fentanyl is a drug that was developed in the 1960s to relieve pain from cancer and chemotherapy. It is a powerful synthetic opioid analgesic similar to morphine. but 50 to 100 times more potent. Fentanyl depresses the respiratory system to the point of failure, leading to fatal overdose. My husband and I found Matt's lifeless body at 11:35 a.m. on December 3rd, 2018. He had been gone for hours, his pale, lifeless body with his glasses still on. Every time I blink or try to sleep, I see his dead body in the room right next to ours. The questions never end in my mind. The what ifs are never silent. The guilt as a parent is never diminished. I'm so sorry, Maggie. The first emotion is shock and pure abandonment. We aren't allowed to grieve in our society properly. I felt extreme fear. The dread my son felt was now my permanent friend. People judge his death not as valid as a cancer death or an accident. Matt suffered with the disease for 18 years. Our whole family suffered. Matt's death is a tragedy. Matt always felt like he didn't fit in this world as an adult. He probably was astonished when greater than 800 people were present at his memorial. He probably couldn't believe our first walk in his honor, Freeze Fentanyl in its tracks, had greater than 450 people present. In the last 3 years, we have raised over $30,000, and with our largest contributors going here to the Harris House in your honor. I still am bitter because I feel Matt was murdered by his drug dealer. He walks free because there was not enough evidence to prosecute. Matt just wasn't important enough. After Matt's death, I felt paralyzed and useless. I still have to pretend to keep up appearances. I am broken. 2 weeks after Matt's death, my daughter found the group soul from a friend named Sarah. My daughters and I met the most incredible people who understood our loss and could help us through our dreadful journey. Marianne Lamons is our fearless leader. She started this group because she lost her 21-year-old son, Ben, to an overdose of heroin and found no support after his untimely death. Everyone in this group has been brought together by loss of a loved one to addiction, overdoses, and drug and alcohol abuse. We all understand the pain of losing someone with substance use disorder and their tragic demise. Losing an addict is a complex form of grief. As I've stated before, people don't see addiction as a disease and feel their deaths are preventable. This is a stigma we need to erase. The hell of losing your child is unable to be rated on a pain scale. It causes physical pain and mental anguish. When you lose a child, even an adult child, you lose an entire lifetime of dreams, hopes, wishes, and plans. Sorrow drains you of all energy, seeing the beauty of what remains. I wish I knew then what I knew now. In the last 3 years and 5 months, so much has been discovered. I would understand more of what Matt was going through. I could have supported him more. I still ask why. Why my son? Matt's sisters suffered daily with the loss of their only brother. They describe their lives as a three-legged table, able to barely balance. Their lives have been changed forever. I feel like part of my body has been amputated. I struggle every day to see any kind of normalcy. Grief teaches us how much we have loved. The constant worry and assault of being the parent of an addict doesn't even prepare you for this kind of loss. My son should be 36 years old. He died 3 days short of his 33rd birthday. His absence is felt at every family event. He was our comedian. He was someone who could take the craziest moment of your life and turn it into a one-liner you would never forget. He was an artist. He was smart. He was an IT geek. He had the kindest, beautiful blue eyes. He was always my champion. Matthew knows he is loved. Sometimes I'm afraid his memories are becoming blurred. This frightens me. Grief can strike at any time. It's an evil demon that rocks you clear to your soul. Grief is a lonely companion. Your whole world collapses. Friendships and relationships change. It is important to network with others and that understand your anguish. It is important. You need to listen to their wisdom, for they have walked in your shoes. They will help you navigate your insane emotions. Some days denial is your only friend, and it helps you to survive. I really still can't believe this happened to my beautiful family. Our legacy is marred forever. I can't save my son any longer, but I hopefully can save another precious life. So in Matthew's honor, I come before you bearing my soul, hoping you understand. You, all of you out there, you are somebody's everything. You are beautiful. You are an important and necessary part of this world. You are not alone. You should be so proud of the progress you are making. Every day you stay clean. You reinforce your strength to keep fighting the good fight. You are more capable than you think. I hope wonderful things happen to you, and when they do, I hope you believe you are worthy of every single one of them. Your sobriety and life means everything to me and all the members of Soul. May God bless you with the gift of sobriety and a long and magical life. Thank you.